我要健康，脉动全民。大家好，我是 Dr. Alice， 我是眼科医生。If you or your family members have diabetes, please have your regular eye examination because in the early part of diabetes, there is no symptoms. Prevention is better than cure. For diabetic, right? Most of the time, the patient doesn't complain of any vision loss. They will be like normal people walking around, they are going to work, they're going to have family time, they go and see movies, they go shopping, so they don't have any symptoms. It's only when the diabetes becomes very, very severe, then they will notice that there's something wrong with the eye. But some patients, when the sugar is very high, they can tell you that, oh, they cannot read the small words, so they have refractive error. So patient will know that, okay, maybe the sugar is high. But for most patients, they don't have any symptoms. Those with symptoms, they already have the severe disease, like maculopathy, the macula is swollen, so that they feel that the center vision is very blurred. Those who see the floaters, those are already those with bleeding in the eye, and those are considered very serious. When the ischemia or not enough oxygen in the eye is so bad, they actually also develop what we call neovascular glaucoma, Chin Chiet Ying, due to diabetes. It's very important for patients who are pregnant, and if they have diabetes, they have to have their eye examined every trimester, every 3 months, to check for diabetic retinopathy. Because during the pregnancy, the metabolic rate is different and the hormone changes, so there's increased risk in diabetic retinopathy. Only 45% of Malaysians with diabetes have their eye examined. So in our setting, we can either see the ophthalmologist, which is the eye specialist, or in some optometrists who are well trained, they are qualified also to check the eye. Sometimes in some centers, they have a fundus camera. Nurses can take photo of the retina, and then they send the photos to the doctors, the eye specialist, to have a review, or family medicine doctor to check whether there's any diabetic retinopathy. In diabetic retinopathy is classified into category like mild, moderate, and severe, and the last stage is proliferative type. That is the one that you need to treat with laser in the eye. We use laser to treat the retina so that the oxygen requirement of the retina is less, and therefore the new vessels will regress. It's more like lack of awareness. A lot of people doesn't know that you have to check your eye if you have diabetes. They only check their eye when they feel that they can't see. So I think education is very important. The second thing is maybe fear. People are afraid to go and see the eye doctor because they don't know what to expect. And they also, maybe they are worried about maybe there's something wrong with the eye and they don't want to know about it sometimes. I think education and to create awareness, to tell them that to detect the disease early is better than to detect it late. Because when it's late, it's no longer able to have a good vision after that.